My name is Valita. I'm a registered nurse at Spring Hill Memorial Hospital, and I work in the nursery. As a nursery nurse, my morning begins each day with a report on the patients that we have in the unit at that time. We look for the time and day they were born, how they reacted at birth, and any problems mother or baby might have had at that time. After report, the number of babies are divided between the nurses that are working, and I provide care for my babies. We start with getting the vital signs, the temperature, the heart rate, and the respiratory rate. We bathe the babies, make sure they're clean, and in the morning time, the physicians or the pediatricians come in to see baby. At that point in time, babies are taken to the exam table. The report is given to the doctor. We also attend all deliveries, whether they're vaginal deliveries or C-sections, or anytime there's a problem and they call for a nursery nurse to come. Sometimes babies have problems when they are born, and at that particular time we have to sometimes resuscitate babies or do CPR on babies, or we may have to intubate babies, or babies are real sick, mothers are real sick. Those babies has to be taken care of, and they are brought to the nurseries for any problems. At that particular time, we do an assessment on baby to check out their heart rate, their breathing, lab work, their oxygen level. If they need oxygen, we would put a box over their head to give them oxygen. The report is called in to the doctor, and at that point in time, the doctor will in turn give us orders back. We will at times stick baby to draw blood work, like a blood count or a CBC. We draw blood cultures. We will start IVs on babies, whether they are 1 pound babies or 10 pound babies. We do IVs on all those babies. A lot of time, people coming in and say, I want to take care of babies, but oh, I don't want to do that. That's all a part of what we do. We don't separate all the good babies and all the sick babies. Also now, there are still birth defects in the 21st centuries, and those babies need our care too. Those mothers need our care because there's a transition for them to adjust to a baby that has a birth defect. Unfortunately, in also what we do, some babies that are born don't stay here with us. Maybe a short-term life, and we provide care for those babies. We provide care for mothers also. As a nursery nurse, we are all scheduled for 12-hour shifts. We are scheduled for 3 days a week, so it works out really well for everyone. There are stressful times when we get very premature babies and all the things that we're required to do on those babies. It is very stressful when there is a loss of baby. No matter what all the things we have done sometimes to resuscitate a baby, it does not help. And that's the most stressful time of all in dealing with what we have to deal with. The qualification to work as a nursery nurse will be an RN. You can get an associate from a 2-year college, but most hospitals are encouraging the nursing with a Bachelor of Science degree from a 4-year university. Once you have obtained your bachelor's and you have passed your state board and you make it through your 90-day orientation, once there, you are CPR certified, which is a basic life support. But in nursery, we take it a step further. There is national certification for babies for resuscitation, NRP, and we're all required to take that test. It's a skill test and a written test, and that you have to pass and have to renew every 2 years. So your bachelor's degree, your basic life support, your CPR, and your NRP are required to work in the nursery. The best part of the day is when you have worked really hard on a baby that had very bad problems or did not want to breathe, maybe the heart rate wasn't up initially, and to finally have that baby screaming and crying after your work you've done. That's the best part of the day. The worst part, the ultimate worst part, is when you've done all you can do. Medications, resuscitation, chest compressions, and at the very end, after 30 or 45 minutes, that baby still is the death of a baby. That is the worst part of the day. Nursing is a very honest and decent living. You can make a decent income. You can provide for your families. But do not forget, when working in nursing and in healthcare in general, you will get your hands dirty. You deal in blood, you deal in urine, you deal in stool. You will get it on your hands, you will get it on your clothes. It may get into your face and your eyes if you working in certain areas. Things, skills that you have to have when working in a nursery, number one is patience. You have to be able to tolerate the baby's crying. You have to understand what the different crying sounds mean. You have to tolerate the parents, the grandparents. There are some babies who are addicted to drugs at birth, and those babies are very challenging for the nurse, for the parent, and for anyone who's taking care of that baby. And those things you will have to be able to tolerate, understand, love them, nurture them, and sometimes grow them here in the nursery with you. But nursing is a honest, decent living. With your education of nursing, you can go anywhere. Whether you're working in a local nursery or if you're traveling to outside of your area, outside of your state, to other states to be a traveling nurse, there are jobs available in nursing.